our lecture today about central nervous system. The central nervous system consists of brain and spinal cord.
ابدي يا احمد ابدي.
Body ستالان. Body. The central nervous system consists of brain and spinal cord. It is referred to as central because it combines information from entire body and coordinate activity across the whole organism. العفو بس الصوت واضح؟
ايه واضح واضح.
تمام أستاذ. This is the central nervous system consists of a brain and all its parts and the spinal cord. The brain has three main parts. The cerebrum, who is the largest one. The cerebellum, which is also called little brain, and the brain stem. The brain stem were also three parts: midbrain, pons, and medulla oblongata. Now we talk about the cerebral hemispheres. The cerebral hemisphere fill the cranial vault above the tentorium cerebelli. Right and left hemisphere are connected to each other by the corpus callosum, and otherwise partly separated. Yeah, above the corpus callosum, it is partly separated by the medial longitudinal fissure. The hemisphere consists of gray matter, اللي هي cortical gray matter, white matter, basal ganglia, thalamus, hypothalamus, pituitary gland, and limbic lobe, and also contain the lateral ventricles. This is an MRI, coronal, axial, and sagittal sections. Show the T1 MRI showing the content of cerebral hemispheres, which is the gray matter, white matter in T1 appear white. Why? Because it is containing fat, and T1 الفات هي hyper intense. This is the corpus callosum, where the two hemispheres are connected to each other. Above the corpus callosum, it is both hemispheres separated from each other by median sagittal fissure. And this is the gray matter, this is the white matter, this is the caudate loop and lentiform caudate nucleus and lentiform nucleus, which is from the basal ganglia. This is the thalamus, both thalami, right and left thalamus. And this is the lateral ventricle, anterior horn and the posterior horn. This coronal section showing that it is the cerebral hemisphere located above the tentorium cerebelli. Below the tentorium cerebelli is the cerebellum. Now we talk about the cerebral cortex. Cerebral cortex, يعني both hemisphere, each hemisphere has one lobe. Both hemisphere, two lobes of frontal lobes, parietal lobes, two occipital lobes, and two temporal lobes. The frontal lobe located anterior to central sulcus. This is what's called central sulcus. Frontal lobe located anterior to frontal sulcus and above the salvian fissure, and also called lateral sulcus. Salvian fissure also called lateral sulcus. For above the lateral sulcus and central sulcus is the frontal lobe. Parietal lobe posterior to the central sulcus, also above the lateral sulcus and anterior to parieto-occipital sulcus. The occipital lobe located posteriorly to the parieto-occipital sulcus. And lastly, the temporal lobes located below the salvian fissure or below the lateral sulcus. So this is important anatomical landmark to differentiate between the lobes by imaging. Now we take each lobe separately. The frontal lobe, which is as we talk, it is located anterior to the central sulcus. Here it is the central sulcus, the frontal lobe, all this part anterior to the central sulcus and above the lateral sulcus. The areas of the frontal lobe is the precentral gyrus, what is called also the motor area, which is responsible on the motor activity of the body. Anterior to the motor area, it is called a premotor area. This is the premotor area. And the inferior posterior aspect of the premotor area, what is called the Broca's area, which is located in the dominant hemisphere only, which is most of people, dominant hemisphere who are left side, and some of them right side. The Broca's area located in the dominant hemisphere, and it is responsible for speaking. Anterior to the premotor area, the prefrontal area. Prefrontal area responsible for the autonomic cognition, intellectual function. On the medial aspect of the frontal lobe, above the corpus callosum, there is a sulcus called callosal sulcus. Above this sulcus, the lobe, the gyrus, it is what's called a cingulate gyrus, which is part of the frontal lobe also. Here it is an sagittal section, MRI T1, showing the corpus callosum and the callosal sulcus and above the cingulate gyrus. Now the parietal lobe. Parietal lobe located posteriorly to the central sulcus, and it is and above the lateral sulcus. It is consist of the central sensory area, which is also called post-central gyrus. يعني anterior هي كانت pre-central gyrus responsible for motor, the post-central responsible for sensation of the body. And the areas is some parietal association areas, which is coordinate the stimuli of sensation. The temporal lobe located below the lateral sulcus. It is divided into three gyri, superior, middle, and inferior, by a superior and inferior sulci. It is consist of auditory cortex and the temporal association cortex. Auditory cortex responsible for the hearing, and temporal association cortex, it is responsible for the integration of stimuli of hearing. The occipital lobe, which is located posterior to the parietal and temporal lobe, and what's previously say, it is a posterior to the parieto-occipital sulcus. Parieto-occipital sulcus, sometimes it is difficulty seen on the lateral aspect, but it is seen more on the medial aspect of the hemisphere. The occipital lobe consists of the visual cortex, which is here located around the calcarine sulcus. This is what's called the calcarine sulcus, and around it is the occipital visual cortex, responsible for the vision, and around it is the occipital association cortex, which is also responsible for the interpretation and of the stimuli to the visual cortex. There is another part of the cerebral hemisphere, what is called the insula of Real, which is also part of the cerebral hemisphere that located deep to the parietal and temporal. And when we, when do dissection of, when do a separation between the parietal and temporal, this area known as the insula, where on it is branches of middle meningeal artery run. Some told that it have unknown function, and other say that it is a participate in the sensory cortex responsible for the taste. The parts of the frontal, parietal, and temporal overlie the insula called operculum. The parts of the parietal, frontal, and the temporal overlie the insula, it is what's called operculum. Here it is a special area also related to the speech, but it is related to the understanding of speech. Broca's area responsible for the talking. But the Wernicke's area يعني هي a receptive area of speech, which is here located at the junction between the parietal and the upper temporal lobe. Radiological anatomy of the cerebral cortex we most commonly use is the CT scan, axial CT scan. Here it's showing the gray matter, gray cortical matter, and here is the white matter. In CT scan كلمة white عكس يعني الوايت ماتر راح تكون هي الداركر والجراي ماتر راح يكون هو الوايتر because it is also related to the presence of fat. الفات الموجود بالوايت ماتر. بالفات بالسي تي it is blacker. بالتي 1 الفات is brighter وبالتي 2 يعني يكون هم blacker similar to the CT. You can differentiate between the gray and white matter. This is the gray and this is the white matter. This is the basal ganglia, which is the caudate nucleus and lentiform nucleus, and the thalamus. This is the lateral ventricle. More superiorly, see the sulci and gyri. This is the central sulcus. Anterior to it is the precentral gyrus, and posterior to it is the parietal part, which is called postcentral gyrus. So when you see here this image, the frontal lobe occupy most of the anterior aspect in this axial section. So that don't confuse. This is not a parietal; it is part of the frontal lobe. MRI of the brain, which is show us more detailed information about the anatomy. Here it is an axial T1 MRI, and here it is a sagittal T1 MRI. Also show, as we say, the white matter in T1 brighter, and this is the gray matter, caudate lobe, lentiform, thalamus, and the lateral ventricle. This is what is called septum pellucidum. This is the corpus callosum. We next talk about its parts, and this is the fornix of the lateral ventricle. This is the cerebellum, tentorium, cerebelli. Above it is the cerebral hemisphere. This is the stalk of pituitary gland, the pituitary gland stalk, and this is the optic nerve. Brain ultrasound, especially in the neonate, it is one of the important investigation tool to see if there is a hydrocephalus, if there is a intraventricular thrombosis or intraventricular hemorrhage. فعندنا الcoronal section والsagittal section. Here it is the coronal section of an ultrasound. Neonate, especially the fontanelle, not closed, and you can see inside. This is the median sagittal fissure, and this is the sulci. This is the corpus callosum, lateral ventricle, and septum pellucidum. This is the caudate nucleus, lentiform, and thalamus. This is the corpus callosum, more clearly seen. There is what is called calcar avus. Calcar avus هو part of the part of the white matter may extend it to the atrium of the lateral ventricle. On a median sagittal section, when you see it, you think it is a thrombus inside the lateral ventricle. But when you take a coronal section, you will see it is extension from the white matter. So should not be mistaken for a pathology. Now we talk about the white matter of the cerebral hemispheres. White matter represent the fibers of the neurons, يعني axons of the neurons located in the gray matter. There is 3 types of the fibers. The commissural fibers, which is connect the corresponding areas of 2 hemispheres. Commissural, connecting the corresponding areas of 2 hemispheres, like a corpus callosum. Association or arcuate fibers, which is connect different part of the same hemisphere, and a projection fiber, which is join the cerebral hemisphere to the lower parts or to the lower centers of the brain. So there is the commissural fiber, which is connected between the corresponding part of the 2 cerebral hemispheres, projection fibers, which is descend from the cerebral hemispheres down, and the association fibers, which is connect the areas of the same cerebral hemisphere. Now we start with the commissural fibers. The most important one is the corpus callosum. It is 10 cm long, connect, as we said, the corresponding parts of the cerebral hemisphere. It has parts, an anterior inferior part, which is located anterior to the lateral ventricle, and inferior to the anterior lateral ventricle, called rostrum. This is part when the corpus callosum is deviated. It's called genu, and here it is the body, which is the largest part, and here is the splenium. You see the splenium is the thickest part of the corpus callosum, and the rostrum is the thinnest part of the corpus callosum. This is the corpus callosum. The fibers that it is run lateral from the corpus callosum, which is connected the 2 hemispheres. The anterior part, it is called a forceps minor, and the posterior part, it is called a forceps major, and between them, it is called tapetum. After the corpus callosum, now the anterior commissure. The anterior commissural fiber, a bundle of fiber in the lamina terminalis in the anterior wall of the 3rd ventricle. The fibers pass laterally in an arc, indenting the inferior surface of the globus pallidus. The globus pallidus is part from the lentiform nucleus. Lentiform nucleus else divided into the globus pallidus. نشوف بنوصل إن شاء الله. The anterior commissure is part of the olfactory system and connect the olfactory bulbs, the cortex of the anterior perforated substance, and the piriformis area. Here it is the site of the anterior commissure. It is anterior in the anterior wall of the 3rd ventricle. Here it is the anterior commissure. الهابينيولار commissure, it is connect the 2 habenulae. الهابينيولي, this is the left and this is the right. Connected between them, it is called habenular commissure, and this is the habenular commissure. It is located anterior and superior to the pineal gland. Pineal gland here, and anterior superior to it is the habenular commissure. This is a small commissure, as we said, situated anterior superior to the pineal gland, that pass posteriorly along the upper surface of each thalamus and unite in a U configuration in this commissure. The posterior commissure here, it is located, this is the pineal body, here the site of the habenular commissure, and here is the site of the posterior commissure, which is connect the it is situated anterior and inferior to the pineal body. The habenular commissure anterior and superior. The posterior commissure located anterior and inferior to the pineal body and connects superior colliculi, which are connected with light reflexes. Here it is ACPC line, اللي هو anterior commissure, posterior commissure line below the thalamus. Above this line is the posterior commissure, and below this line anteriorly is the anterior commissure. Another commissure, hippocampal commissure, also called fornicial commissure. It is located connected between the fornixes of the lateral ventricle, fornix, and this is the fornix between them, called hippocampal commissure. Now we complete the commissural fibers, which is in rapid review: the corpus callosum, anterior commissure, the posterior commissure, habenular commissure, and hippocampal commissure. Now, the projection fibers, as we say, the projection fibers, it is connect the cerebral cortex and hemispheres to the lower centers, which is this fiber consists of afferent and efferent fibers. That most important one is the internal capsule. Internal capsule, it is divided into anterior limb. The anterior limb located between the caudate nucleus and the lentiform nucleus, and the posterior limb between the lentiform and the thalamus. Between them, this is the sharp angulation area known as the genu. Each limb of the internal, each limb transmit a special fibers. This is an axial T2 MRI. This is the white matter is black because T2 water is brighter than the fat, and because the white matter is fat, it is appear darker. Here it is the anterior limb of the internal capsule. Here is the genu and the posterior limb. This is a diagrammatic view, show the anterior limb, caudate nucleus, lentiform nucleus, between them anterior limb, genu, between the thalamus and lentiform nucleus is the posterior limb. Here, showing what is the part of the internal capsule transmit. The anterior limb of the internal capsule transmit mostly frontopontine fibers. The genu and the anterior two-thirds of the and anterior third of the posterior limb transmit most of the motor fibers, which is corticonuclear, corticospinal tract, and corticocerebral tract. These are responsible for motor fibers. The posterior part of the posterior limb transmit the parietopontine, temporopontine, and occipitopontine fibers. The more posterior هو temporopontine responsible for auditory for the hearing. Radiological features of the commissure and commissural and projection fibers. An X-ray only used to see if there is a calcification. When there is a, because the commissure, especially the habenular commissure, may calcify and may be seen on the plain X-ray. It is maybe appear as a C-shape calcification. CT and MRI, which is show us more details about the fibers. Here the CT scan. This is the part of the corpus callosum, what's called the genu. This is the posterior part of the corpus callosum, splenium, and this is the projection fiber, the most important one, internal capsule, anterior limb, genu, and posterior limb. Here it is sections of T1 MRI, coronal, axial, and sagittal. In sagittal section, this is the corpus callosum, this is the rostrum, genu, body, and splenium. This is the fornix of the lateral ventricle. Here it is the internal capsule, anterior limb, genu, and posterior limb. Here it is the internal capsule between the anterior limb, between the caudate nucleus and the lentiform nucleus. There is what is called MR tractography. It is a functional study, not anatomical study. Study the function of these fibers, as we said, the commissural fiber, the projection fiber, and the arcuate association fiber. So this is what's called MR tractography. Study the function of the fibers. This section shows us the development of white matter according to the age. This is the upper pictures, T1, and the lower pictures is T2. This is the T1. As we say, the white matter in the T1 should be bright. Because of the neonate, there is no complete myelination of the nerve fibers in the white matter, so that it is appear to likely similar to the gray matter, and we cannot differentiate between them clearly. This is a neonate. This is a 1 year baby. You can see here it is the development of the white matter become clear visible, and here it is older child, and so show complete development of the white matter. Here it is T2, and also the newborn, because of incomplete myelination, also a T2 reversal to the T1. Here it is the incomplete development of the white matter, start to develop the white matter, and here complete development of white matter in an older child. So that the development of myelin from deep to superficial, posterior to anterior, inferior to superior. And thank you for all. Now go to the quiz.
عشت ايدك احمد، يعني نايس لكتشر وهذه. واللي عنده سؤال الدكتور احمد خليل قبل ما نروح على الكويز. معكم دكتور احمد، اسالك سؤال. اكثر الايمجز مال الام ار اي انت جبتها تي 1 مو صحيح؟
اي نعم استاذ.
شنو السبب؟
السبب استاذ انه دا اشوف انه الاناتومي بالتي 1 يكون better than تي 2.
هذا الصحيح. اذا نروح على الكويز. ماكو اي سؤال؟ نروح على الكويز.
طبعا استاذ بس قبل الكويز ملاحظه صغيره هنا تعرفوا لو نسيت اقولها. ليش اخذنا هذا الديفلوبمنت مال البيكتشر مال الديفلوبمنت مال وايت ماتر على مود ما يصير ميستيكن مرات انه this is mistaken as a leukodystrophy, but when we return to the age it is a normal because there is no complete development of the white
طبعا
matter.
هاي المايلينيشن والديمايلينيشن هذا موضوع مهم بالبيدياتريك ايج جروب اكيد يعني. إذا نروح على الكويز. نختار محمد مهدي. محمد مهدي.
نعم أستاذ. واحد هو الانتر هيمسفيريك فيشر.
واحد انتر هيمسفيريك فيشر. اكسلنت. نورة محمد.
نعم أستاذ. رقم 2 هو التابيتم.
اوكي. عبد الكريم ناهل نمبر 3.
رقم 3 كوربوس كالوزم.
Which part?
جينيو.
Which part?
جينيو.
جينيو. اللي هو الانتيرير. البوستيرير سبلينيا. عقيل عرب نمبر 4.
أستاذ head of right caudate nucleus.
الهيد of the right caudate nucleus. دعاء على
نعم.
number 5.
Right lateral ventricle.
Which part?
Anterior horn.
Excellent. أو الهورن أو الانتيريور. number 6 هبة عماد.
نعم أستاذ. Number 6 interventricular foramen.
Excellent. حيدر كريم number 7.
نعم أستاذ. Number 7 Sylvian Fisher.
سيلفين فيشر. اوكي. ايباد منو؟ احنا قلنا الاسماء كتبوها همينا نفس الشيء. هبه. نمبر 8.
Number 8 external capsule.
external capsule. زين. محمد فرحان.
نعم أستاذ. Number 9 anterior limb of internal capsule.
of the left side. مو صحيح؟
of the left. أكيد طبعا أستاذ.
أحمد عندك غير هذا الصورة؟
لا أستاذ 17 نقطة لأني موجودة.
أستاذ محمد خليه يكمل. أستاذ محمد وصلنا رقم 10. أستاذ محمد.
إيه أستاذ وعد وياك يعني.
وصلنا رقم 10.
شيء ما على.
نعم أستاذ.
10.
بوتامين of the left lentiform nucleus.
زهراء صباح رقم 11.
نعم globus pallidus of left lentiform nucleus.
globus pallidus. رقم 12 لا رناصير.
posterior limb of internal capsule.
زين 13 13 علي حسين.
نعم أستاذ. the left thalamus.
14 زيد.
نعم أستاذ. الكوروني plexus of the left lateral ventricle.
15 نور علي. نور بابا. نور موجودة؟
أستاذ اليوم كول نور.
كازان.
رينايتد.
كازان.
نعم أستاذ. left calcarine sulcus.
16 خنسة.
نعم أستاذ. رقم 16 superior sagittal sinus.
نعم. آخر وحدة مو 17 بقت عندنا سالي عبد الرضا.
نعم أستاذ. سبتم بليوسيدم. أي أستاذ. سبتم بليوسيدم.
آخر وحدة مو أحمد.
نعم أستاذ.
عاشت يدك أحمد. شكرا.